And I want to welcome everyone once again to our final session of our Staying Well Together series. We're joined today by Bonnie Taylor. Bonnie is the owner of Bonnie Taylor Counselling. Many of you have been with us before for Bonnie to be to speak and to share her thoughts with us. So I won't give her too much of an introduction because I'm sure she can just introduce herself. So without further ado, welcome, Bonnie.
Thank you, Dan, and thanks to everybody for joining us today. I know as the weather gets nicer, there's more of a draw to see what we can do outside, especially over the last 3 or 4 days. I'm telling you, I don't think I've slept as well as I have the last few nights because I've been trying to get as much fresh air as possible because we've been all trapped indoors for so long. I would, again, just like to thank you, Dan, for letting me join you all for this wellness series. And I hope that for those of you that have joined before, have taken into consideration some of the things that we've talked about and maybe even started to apply them within your own life. And even if you haven't yet, maybe it's given you some thought of, maybe I should start to work on that or give that some consideration. So I'm hoping today for our final session together, at least in this segment, that if there are questions that come up, as Dan says, like just please, if you want to, type them in the chat, or if you want to send them to Dan to read them through, or even just being able to ask them. I'd like this to be interactive. One thing that we do here and we all experience is that social isolation and not having an opportunity to talk to many people outside of our bubble. And so feel free if you do want to kind of chime in, that you are more than welcome to do so. Now, over the last couple of sessions, the one thing that I think I have talked about a few times, because I think it is so critically important, is the self-care, especially during this pandemic, but nonetheless, every day. A lot of times we don't recognize the fact that even though many of you may have care providers coming in and out of your homes, or you might have family members that are there and with you. Many individuals feel that they're taking care of my physical needs, which is what they're there for. Yes, of course. But maybe people aren't really stopping to say, how are you doing? And it might not be their job to provide you that mental health support. But it's also just making that connection to mental health and physical health and overall wellness. And that's something that it is important for you to start to think about with the people that are closest to you in your life. How do you communicate with them in whatever way you communicate to let them know when you're not doing okay, when you're feeling sluggish, when you're feeling unmotivated, when you're kind of almost getting that hopeless feeling of, we've been dealing with the pandemic for the last year, but many individuals have also felt somewhat isolated longer than that, depending on what your support system is and your ability to interact in certain activities in the community, and especially during the winter months, has always been very limiting. So as you are thinking to yourself, and we've, kind of talked about the self-care and talked about the importance of recognizing in us when we're not just quite feeling the way we want to be feeling, how do we let people know? And I'd like to open it up to anybody who feels comfortable sharing how they tell people in their lives when they're just kind of feeling a bit off or just not feeling so great.
Well, it's not intentional, but I become short-tempered, and I become maybe a little snappy, maybe a little bit harsh with family or friends, and that's not a good example of how to deal. I'm aware of that, but realistically, right? I mean, you get burdened by life's challenges, and it's not always easy to say that you need help, and sometimes you just sort of like end up taking it out on others.
And thanks, Dan, for saying that, because as you said, it might not be the best way of doing it, but the fact that you're so self-aware, and maybe you've become aware because people have told you that that's what you're doing. But even when people tell us, why are you acting so angry, or why are you being like this? You might think, what are you talking about? I'm just the same. I'm the same as I've always been. And then you realize when it comes out of your mouth, like, oh, okay, maybe I'm not. But it's those cues that when we start to recognize it in ourselves, that we're maybe not treating the people around us the way we normally would, or hearing it from them, that it's a great indication of maybe something needs to change in how I'm coping right now. Thanks, Dan.
I have to agree with Dan, because I think everybody's not used to working at home all the time and seeing your family members that live in your household 24/7 every day. So I think I understand Dan's point.
Well, thank you for saying that too, because if there's one thing that I've heard from individuals that I've been working with over the last year, is exactly that. People that are home when they're used to being anywhere else. And how many times have I heard before the pandemic, oh, I just love to have the weekend at home doing nothing, just kind of hanging out with my family, not running around anywhere, not doing anything. Well, whoever put that wish out there, we need to find out, because their wish came true, but it kind of went globally for all of us. But you're absolutely right in how we get along with each other. It really does change dynamics when we're all in the same space. We could all live in mansions, or we could live in tiny houses or smaller apartments. It doesn't even matter kind of the environment that we're living in, except the fact that we're kind of together 24/7 all the time. And taking a look at, based on the fact that I've been with this person nonstop, how am I treating them differently, or how are they treating me differently than when we were busy and going to school or work or volunteering or whatever we were doing to keep ourselves active? Thanks for that point.
Hi, Bonnie. I kind of struggle with ever asking for help, or ever telling anybody that I'm not feeling 1000% great, because that's kind of the persona that I've developed. And so I feel, and this is something I really need to work on, that asking for help or not being 100% is a sign of weakness or something. So, and I know that's not true, because I love to support other people when they're asking for help, but I personally really struggle with that. So yeah, I'd love any tips you have on just getting over that feeling of not having to be, on all the time.
Well, I think that is such another excellent point, because we have different personas. It doesn't mean we change 100%, but when we go to school or we go to work or out volunteering, doing stuff, we do put on it a bit of a different face. I used to use the word mask, but I can't use that anymore because we literally put on masks. And yes, I have asked people, do you wear a mask when you go out? Yes, I do. Okay. But we have an impression that everyone expects us to be the way they see us. And I actually had a new individual that I was working with the other day that I've never met. They don't know me, and said, well, I can't be happy all the time like you are. And I thought that was so interesting to have that point, because generally and I'm probably a bit like you, Sherry, in that way too, where I've worked with individuals for so many years that this is my personality. I'm genuinely kind of the way I am right now, I think. But it doesn't mean that I don't have my own struggles, that I don't have my own down times, that I don't have days where I just need to sit and read a book or just zone out and not talk to anybody and kind of reflect on that. It does take a lot of courage to let people in the door a little bit. It's kind of like when we have company over, pretend the old days when we actually used to have company. I look forward to that. But, we'd open the door, we'd invite them in, we'd make a cup of tea, get some food together, and then we'd say goodbye graciously, thanks for visiting, and leave. But then afterwards, what do? Sometimes we flop. It's like, oh, I enjoyed the visit, but they don't get to see that other part. So what takes a lot of strength is during that visit, whether it's in person, over the phone, texting, and just letting people know that, when they send those, I'm not sure if many of you get those messages from people just saying, hey, how's it going? Replying like I do often, good, how are you doing? But really, sometimes what I want to say is I'm completely exhausted. And it doesn't mean I don't love the work I do. It doesn't mean I'm not happy overall, but maybe I'm kind of struggling. So it's just even snippets of that honesty too, Sherry, and knowing too that if the people you're talking to about it are people that you trust, then trust that they really appreciate to know that they're not the only ones struggling.
It's really hard to do. I learned a long time ago that when you're a helper personality, right? Helpers are often the ones who sort of struggle internally the most, because the very ideology they follow is to help others. That's what they feel comfortable with. That's what they're good at. They want to make other people happy. And oftentimes, as a consequence, they don't address their own needs, right? Because it's almost like deflecting, right? You can deflect your own unhappiness by making someone else happy, right? Mm-hmm. And you generally want to help people as well, right? So it's yeah.
Mm-hmm. Well, and it is that role that many of us take on in our relationships, where we feel that we don't want to bring other people down. We don't want to be responsible for them not feeling good. We don't want to burden anybody else. One thing that has been also common that I've heard throughout the year, and maybe even applies to myself too, is that when I know people around me are overloaded too, then I don't necessarily want to share that, what I'm dealing with them. So then it's like, oh, I'll tuck it in. I'm good. And sometimes if I have a friend that does reach out, how are you doing? And sometimes I'll say, I'm just really tired, or I'm just lonely, or I don't know, like maybe even just kind of using a word to describe it. Then all of a sudden I'm instantly worried, am I putting my stuff on them? Because I'm not wanting them to fix it. I just want them to hear me and sit with me. There's a beautiful...
So I have a comment here, Bonnie, and before you move on too much, somebody sent a comment, said, I tend to mentally hurt myself when I'm feeling upset.
Yeah. And I think many times we say things to ourselves that we would never, ever say to anyone else. And we can put ourselves down really quickly when we would never judge a friend, family member, even somebody we don't know well. We would never judge them that way. It's paying attention to those times when we start to put ourselves down. Do you ever just kind of forget to attend an appointment? Let's just say you had a doctor's appointment, you had anything, and all of a sudden you realize, oh, it was at 1 o'clock. I totally forgot to turn my phone on. And then the thoughts go to, oh, I always forget to turn my phone on. Oh, why? Like, I'm so dumb. Why did I forget to do that? And now what are they going to think of me? Now I'm not going to get, like, all of those, you can see how it starts to escalate. But if your friend called you and said, oh, I can't believe it. I just totally missed my doctor's appointment. I was supposed to turn my phone on at 1. I totally forgot. Would you say that to your friend? You always forget. You never remember to do that. Think of all the other things you've forgotten. So that's an excellent point in really bringing up the fact that that inner critic that we have, it can be very nasty. And being able to stop it and say, wait a minute, I am better than this. I wouldn't talk to anybody like this. So why would I talk to myself that way? And then trying to give yourself almost that evidence to say, no, this is the first time I've ever missed an appointment ever. So why am I being so hard on myself? Obviously, something's going on. And maybe I need to connect with somebody, or maybe I just need to go watch a movie or listen to some music or something to help me kind of relax, because I'm being very unkind right now. Yeah, thanks for sharing that. Anybody else like to comment on how kind of they know when they're not doing so well, or how they communicate it with others? Okay. So Sherry, you brought up a good point of, all right, so maybe you put that out there to people. What do we do with it now? Now that somebody knows, okay, this person is struggling a bit, but then they don't know what to do or say. What are things that we can come up with that we can tell our, whether it's our family, our friends, any workers, anybody that is just kind of noticing that maybe things are a bit off with you, or maybe you've told them that? What?
So, Bonnie, I have a comment here from somebody, and I'm more than willing to read it. I would love if this individual would speak about it, because I think that it's actually a really amazing technique that they do. And so the person who just sent me the comment, if you want to talk about it yourself, I think you have a lot to contribute, but if you want, I can read it.
No, you read it. Just read.
It was you.
Yeah.
So
I
Tanya, what is it that you do to help communicate?
use my feelings cards. Oh, wait.
Can you tell us about some of them? Oh, sorry, Tanya. Can you tell us about some of the feelings cards that you have?
So when I'm feeling like, say if I'm feeling something like nervous, or if I'm feeling tired and I can't communicate, I would show that person how I'm feeling, like tired or sad.
And do you find it easier to pick up that card and say, this is how I'm
Yes.
feeling, instead of trying
Yes.
to describe it? Yeah, that's great.
Yeah.
Thank you for showing us those, because it is a really good way to do it. I'm just going to lean over here for a second. I don't know if I showed this before, but I have people seen like these feeling faces before?
Yeah.
So I used to keep this in my office, and I would have it on the table in front of anybody that was coming in. And I would always just say, like, how are you doing today? Where are you at? And a lot of times people didn't even know, where do I begin? And whether they were kids or adults, it didn't really matter, because we all kind of have a hard time sometimes. You know how you feel, but you just don't know how to put it in words, or even attach a word to it. Sometimes it's just like, I feel like, ugh. So what does that mean? And so even if you feel like that, sorry, I don't know how to look at myself and do this, but maybe you feel hysterical. I don't know if anybody's feeling that way right now. I don't remember the last time I felt hysterical, but then there's happy, there's embarrassed, like there's different ones. And it is kind of nice, because then you could just say, yeah, kind of, this is where I'm at. And it's a starting point for a conversation with others. Yeah, thank you, Tanya.
So Bonnie, just so
Yes.
a couple of instances where I've seen those. So we often see them in a doctor's office, right, where they ask people to describe the level of discomfort they're experiencing, right? So it goes from happy face to red face, angry. But I've also seen it in work meetings where teams will meet on a regular basis and they'll have like emoji cards. So basically, once a week when the team meets, they go around the room and say, okay, so how are you feeling about your week? Because you're right. Sometimes to verbalize, not only is it hard, maybe just to come up with the words, but sometimes you feel a little bit awkward because it's sort of like you're almost identifying a weakness, right? So if I feel sad, right? Because today we learned a colleague of ours passed away. So I'm feeling sad about that. But to just say that identifies, it makes me feel vulnerable, right? It makes me feel weak. Whereas if you said to me, well, I'm going to show you a picture, how do you feel? It's easier, right?
It doesn't personalize it as much for you. And that is something that's different, because if we were together now in a group setting, because we came together as individuals on our own time, compared to when you come together with work colleagues, your answer might be different. And I think it's amazing, Dan, that you are hearing that different teams are doing that, because there's this recognition that people are struggling. We've all been kind of, especially if you've been working from home and remotely, we're not having that chat, on the way to the bathroom even, or just, in between appointments or what. You're just kind of not even having that, like, oh, did you watch this on TV last night conversations. So being able to have a way to touch base, but then it's, what do we do with it when we are honest about how we're feeling, and we pull up the, one of these and kind of pick your face? How would we like to let others around us know what we need then in turn? And Dan, I'm very sorry to hear about your colleague, and being able to kind of let people know you're experiencing a feeling, but not expecting them to resolve it for you. Have you ever told somebody that you're feeling really stressed out? Has anyone ever felt stressed out before? Yeah. I don't think I've met anyone who hasn't felt stressed at some point in their lives. Now, have you ever had someone say to you, oh, well, if you didn't work so much, or if you went to bed earlier, or if maybe you didn't do this or take on so many things, and all of a sudden they're just like rhyming off all these things that, this will fix it for you. But all you said was, I'm just feeling stressed. You weren't looking for them to solve it. So it is okay in those moments, in being able to back up then a bit, to say, okay, thank you for your advice. I kind of just wanted you to know how I'm feeling. I don't know. I'd love to hear from people and what your experiences have been.
Well, Bonnie, and my family and friends will attest to this, I'm one of those fixers. So like when I hear that someone has, I'm stressed or I'm tired, I'm always like, oh, I'll do like research and like, I'll tell them this is how you're going to fix it. But yet I know personally that, like my husband was really bad for this. Like sometimes I just wanted to vent, and he would be like, I'd be like, oh my God, the traffic was like so bad today. And he'd be like, oh, well, if you didn't take this road and you took this, that kind of stuff. And I'm like, that's not what I want from you right now. I just want you to be like, oh, that sucks. Like, too bad, But then I recognize that I do the same thing, especially when it comes to like health and wellness and the stuff that I'm so passionate about, that I know when someone else is complaining about, they've had an upset stomach or whatever, I'm like, this is what you need to be eating. You need to be doing, and that's not necessarily what they need. So yeah, I get that from the other side. I'm guilty of that for sure.
It's really hard, because like I would say that I've changed over the years, but I definitely would be more, Sherry, what you're speaking of, like, oh, you have a problem? Well, let me tell you. That would certainly have been where I was coming from. And honestly, it's the nature of our work. For both Sherry and I, as coordinators, resource coordinators, it's the nature of our job to help people solve problems. So sometimes it is hard to not offer that advice, but I think I've looked at myself, and I think, when I have a problem, when I'm feeling stressed, I don't like it when people tell me what to do, like at all, and I'm usually a pretty private person. So I've used some of that emotion to alter the way I communicate with people, and realizing and respecting that, maybe they don't want to hear all the answers either. They just need someone to talk to, right? Which is difficult to find a balance for sure. I have a comment here from somebody, Bonnie. Says, I go to counseling every month, and sometimes I'm unable to tell her what I want to get off my chest. Do you have any suggestions on how I would be able to help myself to do this?
That is such a great question, because that is something that I know people really don't know where to begin sometimes when they're going to be meeting with their counselor. And even when I do check-ins with individuals that maybe I haven't seen them for a bit, or even 4 weeks, a lot of nothing with pandemic can happen over those 4 weeks, but we kind of forget. One thing that I recommend is that in between appointments, even just like if you have kind of a little notepad, and you keep it with you, if you do it on your phone, if you have somebody that can record this for you that you trust, start to pay attention during the week of, okay, is today a good day, bad day? Just kind of rating yourself. I'm going to take my camera off for 1 second to show you. And is this clear for people? I don't know if it's condensed, but it's kind of that check-in of, I'm feeling, I can't even see the first one, but feeling basically fine, pretty good, you're okay, could be better, I'm really struggling and need support. I think having that, and I've switched it to be my picture so that when I'm doing the online, I took the alpacas off. That was a sad day for me, but I can put them back at any time. But just even having that quick check-in with yourself every day of, where am I at today? Generally, we don't feel the exact same all day long, but sometimes we can think, oh, I felt lousy every single day last week. But did you really? Because there might have been a half an hour that your friend called you up, or you went outside for a bit, got some fresh air or sunshine on you, and it just felt good for that 20 minutes, 30 minutes. So in between appointments, I do recommend kind of jotting down some observations that you're making about yourself, things that you notice have been a bit difficult to deal with, but also don't forget to keep track of things that you have been doing well. Maybe you've been doing some gratitude journaling. You've been, ramping up exercise a bit, eating better, things like that, because those are also things that you can review of how you're coping well in counseling. Another thing that many counselors do is a scaling question, whether it's on a scale of 1 to 5, 1 to 10. It's something that you can set that you like in terms of the numbers. But even on a scale of, say, 1 to 10, 5 being meh, all right, 7's a magic number. Lucky 7. A lot of people kind of aspire to be 7. We can't all be like 10, just fantastic every day. But if you start to track a little bit about yourself too, and then it's something you can report to your counselor saying, I tracked kind of where I was at on average. You don't have to do it every day, but I've been kind of at a 6 where I really want to be at an 8. And these are the things I tried to get to an 8, like going outside or talking to friends, like some of those strategies, but I'm still not quite there. That's a really nice starting point as well. Does anybody have any ideas on kind of what we were talking about with our friendly fixers, which some of us are guilty of, and some of us may not be so happy about when people want to come in and give us a grocery list of things that we should be doing to feel better. What would you like to say to somebody that does give you a big list and they mean well? if Dan and Sherry are telling us right now, okay, this is what you need to do, what kind of advice would then we like to give somebody that?
So basically, how do you tell somebody who's trying to give you advice that you don't really need or want their advice? Well, I don't know. Other people, I can't answer because I'm always the one giving it.
I wonder if, like, when you're giving, you're saying whatever it is, not, I was going to use the word complaint, but that's not really the right word. When you're just saying whatever it is that's upsetting you or that's stressing you out or whatever, that you kind of give like a precursor of like, hey, like, I don't need you to solve my problem. I don't need a problem solver, but I'd love to vent. Like, if you kind of give that as a leading thing, maybe that would put the person in the mindset of like, oh, I'm just here to listen. I'm not here to like actually come up with solutions, maybe.
I think that's
Oh, sorry.
Oh, go ahead, please.
I'm the recipient of a lot of Sherry's lists of what to do. And because of that, I am much stronger and much healthier, and I'm eating better and I'm working out more. Like, it depends on who's giving you that list. Mary Lynn is one of the smartest people I know. She's very strong. She's very energetic. She eats well. So I could take advice from her. But like you said, if you tell somebody, I don't know when to tell somebody that I'm down. One of the reasons is you don't want the list. And another one is you don't want to wear that person out. When you're really having a bad time and you're telling them again and again and again, you're going to wear them out. Like, they're going to mute you off of their phone.
I wonder too, and I think that's great that you're able to pull out, like, this is when it is helpful, because there are also times when we do need help, because we've been feeling this way for way too long and we've tried every strategy. And sometimes I know, like, when I'm working with individuals, I've kind of run out of ideas of how we get through the pandemic, because we're still trying to get through it. So it is genuine if sometimes you're like, literally, I'm so bored and I don't even know what to do anymore, or I've been feeling so for so long, I don't know. So it is being able to ask people, do you have any ideas? Just even, what are you doing on those days that it's, the weather it's beautiful and sunny, but it's still too cold to go out and do anything. What are other people that doing? Like, just kind of almost being an investigator and trying to gather that. But then the flip side is, if someone is feeling that, as I said too earlier, like, you don't want to burden them and you don't want to drain them of hearing the same thing. Like, how are you feeling today? Oh, I feel sad, or I feel down, or I'm just feeling anxious still.
Well,
what you can do is,
I was going to say, sorry to cut you off, Bonnie. I was just going to say, I think the danger too then is that, you then become like their therapist. And I think for me in my life, that's something that I try to avoid, because I'm not a trained professional. I only play one on TV. So I think if somebody has a regular stresses and needs to maybe constantly be coming back to you, I think that person could probably benefit from other supports as well, right?
Well, and that's exactly it. And knowing yourself, like, I've just told Dan every day I've talked to him for the last 4 weeks, when he says, how are you doing? And I'm saying, oh, I still feel kind of lousy. It's being able to almost recognize in yourself, okay, I've been saying the same emotion, which is genuinely how you're feeling, but it's just nothing is feeling like it's changing. So maybe I need to take another look at who are my supports, because am I draining I'm just using Dan as an example, but am I draining Dan because every time I feel down, I know he's going to listen and I know he's going to help to fix me. But then I call him again and then he's like, okay, Bonnie, well, did you try this, this, and this? Okay, I'll try it, but I'm still not feeling better. So it's a nice opener to, even if it's somebody that you trust, to say, you know what, I've been feeling like this for so long, and I thank you for listening to me kind of go on about how I'm feeling, but I'm just not feeling any better. Do you know anybody that maybe I could talk to that is outside of my friends and family? Because then you don't have to also worry about how they're receiving the information. You don't have to worry that you're burdening them or burning them out. And you can just really open up and maybe get some strategies to help move you forward in that. One more thing I wanted to add to that is, if we feel like we notice that we're always telling people negatives, and because, I mean, you're genuinely sharing, like, this is kind of how I'm feeling, don't forget to tell them some positive things you've been doing too. Even if it's just, you're feeling like you're saying the same thing over and over again, pick it out of like, yeah, but I did get out for coffee the other day. That was really nice. And, just not that you're sandwiching the negative stuff, but just don't forget some of that positive stuff, because your friends will want to hear that too.
Well, and sorry, I've got a comment here as well. But just to reflect on what you said, Bonnie, like, that's like the key to my, like, I don't know, sanity. I think that to look at the positives, maybe appreciative of the things that you do have, is important. Not to say that it's always the best answer, and not to say that there aren't hard times or bad situations. But I know that even if I'm talking to somebody, I'll if I'm complaining about something, I will often finish it up with, but you know what, at the same time, blah, 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 right? And sort of put some sort of like optimistic spin on it, right? And I think that that's important for sure. There is a comment here, Bonnie, from somebody. It says, I tend to hide my feelings, and when I'm alone, I hurt myself. Once I get them out for myself, I don't think I need to tell my counselor.
Mm-hmm. The counselor is also there to find out what is happening with you in times that you're not doing so well. Many times when I meet with people, they say, oh, if I only talked to you last Wednesday when I had such a bad day. And if they don't know how you are coping, whether it is a healthy way or a safe way, then they can't help to prepare for those times where you might be hurting yourself, or those times that you might be having really negative thoughts. And the whole purpose too of doing some counseling is to really allow somebody to know what's really going on for you. Because if you don't really open up about those things, then they can't help to kind of give you the tools and the strategies to be able to prepare for those times when you're struggling. And if you do notice that one of the ways that you've been trying to manage is by harming yourself, then it is important to also talk to your doctor and talk to your counselor, get some ideas of what you can do to find some other strategies, because even with self-harm, that isn't something that individuals generally find helpful for very long. Maybe in that moment of crisis, that's something that becomes a little bit habit forming of, oh, that's what I have to do. Oh, that's what I have to do. So being able to remove those things that you typically would use to harm yourself, and then also being able to reach out right away, have a list of crisis supports. If you are aware of the Here 24/7 crisis line, and I think many of you know it, and if you don't, I sent the link to Dan. And if you need that, you can always reach out to him for it. But that crisis line is there for times when you feel like you just can't cope in that moment. So maybe you don't have access to your counselor because they might be more appointment based. But don't forget, the crisis line is there to help you manage. Make a list of those times where If you're really not doing so well, these are the people that I can reach out to, and they're not going to judge me. They're not going to say, oh, you shouldn't have done that. They can say, how can I help?
I'm wondering too, Bonnie, so if somebody's not comfortable with their counselor, right, which does happen, either just it's something, that maybe you don't feel comfortable with, but it is possible that you just don't have a rapport with that person. It's not anything to feel ashamed about or embarrassed about or whatever. I mean, if you go visit a massage therapist, well, if you don't like the massage therapist, if they hurt you or they don't make you feel better, then you're going to find another one. So I think if you find that you are being honest with your counselor, but you're not really feeling what they're throwing back at you, then, it is a possibility to look for a different counselor as well. It's not like you have to stay with the same person necessarily.
Having the right fit in counseling is so important. And we don't always get that the first time. I know for myself, when people contact me to book an appointment, I always offer a 15-minute consultation. I don't charge for that because I want them to have an opportunity to even just chat with me, ask me some questions about kind of where they're at and see if I'm a good fit for them. And many of us kind of know early on when we start to talk to somebody if this is someone that I think I could talk to them, or if I don't know, you don't have a chance. In some of the larger agencies, you don't always get a chance to have that consultation with somebody. So once you do meet with them, whether it's video or phone, or how not many people are doing in person right now, but read your spidey senses and really think, is it just me because I'm so used to tucking things in and not telling anyone, and then all of a sudden this person's wanting me to talk about these things that I've kept hidden for quite some time, and very well, thank you very much. Now they're wanting me to open it up. So it is a good point to kind of think of, how much is it me just not wanting them to judge me, not really feeling uncomfortable, or how much is it that counselor isn't somebody that you think is the best fit for you? And again, it's not because like they're a bad person or anything like that, but everybody we meet in life, we feel a little differently about. And sometimes we get energy from somebody, sometimes we feel they're calm, or sometimes we can notice that they are even just being a little bit more guarded professionally than you would like them to be, just a little bit more open themselves, not about themselves, but just with the back and forth communication. If you feel like it's not a right fit, it's okay to tell the counselor. If they say, many people have told me at the end of appointments that they've had with previous counselors, a counselor will right away say, okay, so when do you want to book your next appointment? And then you feel so awkward because you think, I don't really want to come back and meet with you again. But if you get put in that position and they say, when do you want to book your next appointment? Say, you know what? I think I'm either say, I'll get back to you. You could tell them, I just don't think it's the right fit. But I appreciate the time that we just spent together. Or, even if it is with a larger organization, like a counseling center, say like KW Counseling, for example, you can always call back into intake and just say, you know what, I just don't find it's a right fit with myself and that counselor. Can you please assign me to somebody else? And as counselors, we know that because we want you to feel comfortable in sharing that stuff that you don't feel comfortable sharing with other people.
Well, Bonnie, I mean, this is likely a conversation for another day, but sorry, I went on mute there. There is another layer of complexity that I've experienced, and maybe others in the room have, and that is when you have a disability, if you don't have a counselor who can empathize or understand or sort of meet you in that world, it also has another layer of complexity, right? And I don't mind sharing. I mean, I met with 3 counselors over several years, and each one of them I left feeling like, ugh, like whatever. They clearly don't really appreciate my situation. And then I finally met somebody who did, and they were cool and they're great. So I think that having a disability adds another layer of that relationship. And I'm not sure, that's probably not something we can really delve into too much today, but it is something for sure.
Dan, do you mind me asking, what was the difference? Like, how did you feel more understood even by the last counselor than the other 2?
I think the final counselor that I met, I think she was more honest about the situation. And I think by then, to be fair, I was more honest, because I went in and instead of like just throwing myself into their care, like, oh, what are you going to do for me? I went in there, basically said, look, this is the road I've been down, right? I don't want to have to BS. I don't want you to give me a bunch of small talk and little tips and tricks. I'm an intelligent person. I know my own situation. I just want to have honest conversation. And she was like, sounds good.
And that's key as well. Being able to have an understanding also of why you're going to counseling. Sometimes if there isn't, in the first appointment, goals for why you're there, if that's not established, and even if you've been seeing the same counselor for maybe 5 or 6 times, and you think, I find I just keep talking about the same thing every time, it might be worth just touching base with the counselor and saying, you know what, let's just kind of revisit my goals. And one thing I really want to work on is maybe managing my stress or feeling comfortable talking to people about things that are important to me. Even being able to direct, workers that are coming into my home and having some difficult conversations sometimes with them can be really hard. So you might just kind of need to revisit your own agenda and reasons for reaching out to counseling. And if you find that the counselor isn't really meeting your needs in those goals, then that is a good opportunity for you to reflect a little bit. Is it just that, maybe they're not as experienced in that area? Maybe it's just that, again, it's just not that right fit. So that's where you can kind of take those goals, got your list, and then maybe try somebody else, because it is about you, and no one is more important than you. And remember that. And you don't have to worry about protecting the counselor or them feeling upset or thinking, oh, I don't want to offend Bonnie if I don't keep going to see her, because as professionals, we really truly believe that you need to be with the right person to start to work on those things that they're in there pretty deep. Before we, I know we have a few more minutes too, but before we wrap up, there was a question that had come out at the very end, or just after our last appointment. And that was something that I don't know if that individual wants to ask it to everybody, or if they'd just like me to say the question. I'll give a moment if that person wants to ask it, and if they don't, I'll just keep talking. Okay, so one thing that had come up, because something I had shared in, I think it was the first time that we met, was that I live out in the country. I'm just about half an hour from Waterloo. Tanya, did you want to go ahead?
No, sorry now.
Oh, sorry, I thought you had your hand up.
No, I know what you mean.
Yeah. So being able to see the difference too, when we do talk about connections with other people and social, there is quite a difference. Yet isolation is isolation. I have a friend that lives in a big apartment building in downtown Montreal. And that person lives on his own, is completely surrounded by, I don't know how many people live in that apartment building, tons of them, but doesn't see anybody because they're isolating. I live out in the country, there's only maybe 5 houses on my whole road, which is a really long road in this section. There's probably about 5 or 6 farms where I live, and I'm isolated as well. So we're both experiencing the same thing. One of us is surrounded by people, but everybody's inside with their doors shut. I'm surrounded, well, I do have some animals, as I've shared a little bit about my alpacas, chickens, and my little pup, but and my husband too, and it does come in that order. He knows. But it can be just a different experience. So the one thing that, it makes people aware of a little bit more is individuals living in the rural areas. And that's across not only our province, but our country. And I'm doing some work with Do More Ag, which is an organization that is trying to promote mental health awareness in agriculture and in rural areas, because many people are not having even just a quick contact with a neighbor, and they might say, oh, I haven't seen that person around for a while. Nobody's come to checking. So the difference is living in the rural areas, you have more room, and you feel like you can kind of go out and you don't have to worry about bumping into anybody. So COVID isn't as much of a concern, but it is just the same as being in town or in the city, where we have to make intentional attempts to connect with people, because we're still somewhat under lockdown to a certain extent of how many people we want to have in our lives, especially if many of us are medically fragile and we can't have a lot of people in our lives. It really is still up to us, no matter where we live, to reach out, connect, make phone dates, make Friday night Zoom meetings, watching a movie together, encouraging your friend to pop some popcorn and we're going to watch whatever at the same time while we're going through the pandemic together. And it's different when the pandemic's over. Then we have more flexibility. But what I found last summer is more people were wanting to come visit because I have more space outside to visit. And so it's almost that like, hey, you've got space and I'm in an apartment, so why don't I come visit? That's totally fine because, you still socially distance, but it does have that advantage too. So I hope that helps to answer the question that came through.
Well, that's awesome. Thank you so much.
Did.
Yeah, good job. Okay, well, thank you so much, Bonnie, for joining us these past few months. And I know you and I have worked together for several years. I'm sure the relationship isn't over just yet.
No, it's not over. It's just the season finale.
That's right. It's the mid-season finale so soon. All right, no, that's awesome, guys. Thank you so much. So this is the end of our Staying Well series, as I said, unfortunately, but there will be other things on the horizon. So stay tuned and keep your eyes open for those events that will be coming in your email as time moves on. And if you have any ideas for things that you would like us to maybe do on a regular basis, or maybe a one-time event or presentation, by all means, send myself an email and we'll see what we can do.
And thanks again to Dan and all of you for participating. I hope this was helpful and just even giving you some thoughts for yourself in recognizing what you need, how to communicate that with others, and just take care of yourself. That's one thing, be good to yourselves. And, down the road, if you ever want an outside tour of, a little mini alpaca farm, I'm glad to do that. So just let
I'll be there.
So as Dan, is your main contact, if there are things that come up even around mental health, resources, anything like that, you're welcome. I'm speaking for you, Dan, but you're welcome to reach out to Dan. And if he doesn't have some of those resources, then he can always connect with me and I can pass it on through.
Right.
him.
And I'll finish by saying that Bonnie also has a private practice, and BonnieTaylorCounselling.com is the website. So if you wanted to connect with Bonnie on a professional level, she's certainly available to discuss that with you. So, all righty, guys, enjoy the rest of your day.
Thank you, Dan.
Bye-bye.
Bye, everybody.